Welcome to this educational video with Dr. Marcus Maurer, a dermatologist and allergist actively treating patients with hereditary angioedema.
I'm here to provide educational information on hereditary angioedema. I'm also looking forward to sharing some recent updates from the WAO EAACI HAE treatment guidelines that may be helpful. On-demand and preventative or prophylactic therapies exist for HAE. The current WAO EAACI guidelines recommend that all HAE attacks be considered for on-demand treatment. Attacks should be treated as early as possible, and attacks that affect the upper airway must always be treated. It is advised that patients carry sufficient medication for the on-demand treatment of 2 attacks and carry their on-demand treatment at all times. In contrast to on-demand treatment, long-term prophylaxis refers to the regular use of medication to reduce the burden of HAE by preventing or attenuating HAE attacks. Current WAO EAACI guidelines recommend that patients are evaluated for long-term prophylaxis at every office visit and at least once per year, and considered for patients who face events in life that are associated with increased disease activity. In particular, it is recommended that long-term prophylaxis be considered in all HAE type 1 and 2 patients, taking into consideration the activity of the disease, frequency of attacks, patients' quality of life, availability of healthcare resources, and failure to achieve adequate control by appropriate on-demand therapy.
The current WAO EAACI guidelines recommend that the goals of treatment are to achieve total control of the disease and to normalize patients' lives. Lanadelumab, berotralstat, and plasma-derived C1 inhibitor are recommended as first-line prophylactic therapies for patients with types 1 and 2 HAE.
In the WAO EAACI treatment guidelines, androgens are no longer recommended as first-line therapy for long-term prevention. Androgens can be used as a second-line long-term prophylaxis, but the use of androgens must be regarded critically in light of their adverse androgenic and anabolic effects, drug interactions, and contraindications. Side effects with androgens are numerous, involve the majority of patients, and appear to be dose-related. Now, regardless of the treatment used, the dosage and treatment intervals should be adapted as needed to minimize the burden of disease. Even if a patient is using long-term prophylaxis, it is recommended that all patients have sufficient on-demand medication for the treatment of 2 attacks and carry on-demand medication at all times.